ASHRA was conceived because of a real unmet need in the Australian cardiovascular research landscape, which was for an entity that could help researchers and scientists realise the full potential of their scientific discoveries in terms of translation.
Our research cannot just stop at the publication of a paper. It has to be, how do we deliver the findings of that research into the hands of people in the community and people in the healthcare sector.
MTPConnect put out a call for a cardiac centre, and that provided the opportunity for us to come together as a national group to tackle this big problem of how we get Australian cardiovascular research into clinical practice.
The TTRA Targeted Translation Research Accelerator is really to focus on translation, taking an idea from a lab and turning it into a medical product that can impact, improve a patient's life and also contribute to economic growth. So ASHRA was chosen in a national competitive process because they've got a sector-wide sort of approach. They're really optimistic about what ASHRA and the team can achieve.
The vision for ASHRA is to transform cardiovascular disease research in Australia to focus on clinical impact.
It had to be multi-institutional. It had to be broadly national. We needed to be able to focus on each of the 3 core medical areas of this research accelerator: coronary disease, heart failure and stroke, to accelerate research, to be able to embed training and capacity building initiatives.
We're a virtual centre that brings together academic and industry partners, and we've been able to create a governance and operational model to allow those partners to truly collaborate.
It's a truly national collaboration that expands across multiple institutions in multiple states. Monash University, the University of Sydney, the Victor Chang Cardiac Research Institute, the George Institute for Global Health, the University of Melbourne, and the Australian National University. They are further supported by core partners from across academia, industry, healthcare delivery and advocacy.
ASHRA is really focused on accelerating research at anywhere along the pipeline from basic fundamental discovery through to phase 3 clinical trials. Diversity of investment for ASHRA is really critical because we know that not everything is going to succeed, and we expect that many of our projects will fail, and that's totally fine and expected.
It's the only large gathering, aggregate, of researchers in the field of stroke and heart disease in this country. And by coming together, not only with the academic group, but with the commercial group, the community group, and other facilitators, which enables us to carry out research projects at a rate which couldn't be done through the standard funding processes. And I think this is the real strength of ASHRA. We have supported 22 research projects targeting unmet needs in prevention and management across cerebrovascular disease priority areas of stroke, coronary artery disease and heart failure, with a range of innovative products including digital health, medical devices, therapeutics, diagnostics and behavioural interventions.
Industry partners are critical for the translational journey, and knowing how and when to engage with industry is critical. So having ASHRA there to provide that framework, advice and guidance is really an essential service to the Australian research ecosystem.
The primary goal of the ASHRA Education and Training Programme was to try and instill a sense of entrepreneurship and translation into research projects from the get-go. And there were really 2 main ways that we've tried to achieve that. The first is to hold a series of workshops, particularly targeting early mid-career researchers, and the second has been to hold a series of seminars talking through the challenges of commercialisation and translation.
ASHRA has a very particular focus on Aboriginal and Torres Strait Islander communities, but there's also opportunities for our work to influence how we view and respond to the needs of populations who are culturally and linguistically diverse or living in regional and remote settings.
ASHRA's greatest achievement from a consumer perspective is that it has managed to accelerate research, and that means that consumers are getting the benefits from the research much quicker.
As ASHRA completes its third year of funding, its achievements against the three pillars of research, education and equity are clear. A diverse research portfolio, a bespoke educational and training program, and research projects specific to priority populations.
ASHRA has made a great start. We've got us off the ground. We've worked out a new way of working. We've worked out how to work with partners, do some of the hard things, work out a governance structure, work out how we regularly connect with industry and consumers. But what excites me is what we can do now with this structure.
I can see huge potential and huge opportunity moving forward for us to really build that connection between the cardiovascular research sector, commercialisation and translation.
There's so much to be excited about with ASHRA, working with people that are very engaged for a common good, for a collective good, for Australian patients, for Indigenous and Torres Strait Islander people and patients around the world. I think that's just an exciting concept right there.
Ultimately, our vision is to create a research accelerator that's sustainable, and realising that we are much more likely to do that by being greater than the sum of our parts.